Well, it's got a long name, the SmartDot Laser, but it's a fractionated CO2 laser is what we call it. Right, so this is great for just about everything except for things like rosacea or vascular problems. It's good for sun damage, what we call photoaging, fine lines, crepiness, discoloration, melasma. It treats just about everything on the skin very well. Okay, so what we're going to do here is you're going to hear a little smoke evacuation here. We're going to treat Karen's lower eyelid area. Remember last week or last month we did Gretchen's upper eyelid. This is a non-surgical way to address the lower eyelid area. So what we're going to do here, you'll see this, our little laser grid. We're going to start moving along, and these little areas, you can see the little design there. These are areas where we're ablating. Go ahead and turn that off for 1 sec. The epidermis and injuring the upper part of the dermis. And in doing that, the tissue will respond, and we will see fibroblasts, which are cells in the skin, synthesize more collagen. So she'll have tighter, healthier, cleaner looking skin in that area. Sure, yeah. So generally speaking, ready for the procedure, most patients will come in and we'll use a topical anesthetic agent. It's a cream that we will apply to the face, in this case the lower eyelid area. On occasion, like we've done with Karen here, I'm not sure what you can see. I guess you're seeing that right now in your footage. So, you know, it's like frosting a cake, and basically that stays on for anywhere from 15 minutes to 30 minutes, and it will topically localize or numb up the skin. We'll clean that, we'll use some alcohol to prepare the skin, and then we're ready for the treatment. The treatment itself is okay. This is usually done as a single treatment. The goal is to try to rejuvenate the skin in one session. One thing that I want to comment on, well, the treatment isn't a huge deal. That is, you know, it's 15 minutes for the full face. The recovery really is something. We've got a patient, and I don't know, we have this on our website, but she filmed herself every day recovering. And it really takes about 6 or 7 days before your skin, before you're ready to go out. You use Aquaphor, you have an ointment all week long. It's a mess. Your hair's a mess, everything's a mess, but it does a beautiful job of rejuvenating the skin. It ranges anywhere from $950 to $2,400 if we're doing full face. We can treat neck, we can treat chest, and well, you've got our phone number up there, so thank you. Thank you. Thanks, Liz. Have a good day. So do you want me to... Okay, so we are back. Okay, so we are back, and we're going to finish treating Karen's lower eyelid area. And I just wanted to point out for anybody here. So you just saw in Liz's segment, we'll use a white cream to topically numb things up. With Karen here today, we injected some local anesthesia, the same thing that you would use if there were a little mole or skin tag that we might remove. And her tissue is blanched because there's something called epinephrine in the solution, and the epinephrine constricts blood flow. We don't really need to do this for this procedure, but for the sake of time, we went ahead and injected her. So I want to go back for a moment. Well, years ago, Karen had her upper eyelids done, but last month we saw Gretchen live. We did her upper blepharoplasty, and that's the #1 way. That's probably the single best procedure that anybody can have done for eyelid rejuvenation. We highly recommend it. It's fantastic, and it lasts probably 20 plus years. In the lower eyelid, however, there are a number of concerns that people come in with. I have bags, or I have circles. I have crepey skin, I have discoloration. It looks brown or gray or green or red, whatever the discoloration is. So when somebody has a big bag in their lower eyelid, then, excuse me, sorry, she was just in my ear. When there's a big bag, we'll often perform a lower blepharoplasty. And the lower blepharoplasty, just like an upper eyelid surgery, addresses the fat and or skin. However, even if there's fat in the lower eyelid area, and I'm going to use an analogy here. So if there's fat, we're going to call that a mountain. And the region beneath the eyelid fat is called the tear trough, and we'll call that a valley. So what we used to do years ago is we would take as much fat out as we could from the lower eyelid area, so we're reducing that mountain, and we would take it all the way down to the tear trough, the valley. What we created was a look we call cadaveric. That is, you look like a cadaver. So we might have solved one problem, but your eyes still looked tired and you looked like a cadaver. You didn't look any more rejuvenated. These days, when we perform lower blepharoplasty to reduce fat, we take the fat down a good portion of the way, but we still have the tear trough to deal with. So most of the time, even when a lower blepharoplasty is performed, patients end up coming back 3 months later, 6 months later, and we end up using injectable fillers to augment and fill in that area. And I think maybe on a prior session we showed that, but we certainly will. That's one of the most popular things that goes on these days. In fact, for the past 20 years, one of the best areas of facial rejuvenation, one of the best improvements have been with the use of these fillers. So surgery can address the fat. It's a lot of fun in the operating room. The way that we do this is we'll inject the lower eyelid area. Most commonly, we'll make a little incision on the back side of the eyelid. We literally just retract it, use a little Q-tip, and we expose the various compartments of the fat. It's very exciting because once the fat pops up, people run around in the operating room and we're all excited that we're removing it and we're solving a problem. But again, we're more conservative with that fat removal these days than we have been over the past decades. So, blepharoplasty is the surgery. The other thing that we can do with that is we can remove skin. Sometimes patients will have extra eyelid skin, and you can't see this as well in Karen, but if there's extra eyelid skin, we do what's called a pinch excision. And literally, just like pinching this tissue, we can excise or remove some of the extra skin. We want to be very careful when we do that because we don't want you walking around with your lower eyelid retracted. And here's another analogy that I'll give you. Okay, this is what we say to patients when they come in for this. So first of all, I'm going to move to different anatomy. Let's say we have our elbow and we have all this extra skin. As soon as we bend our elbow, the skin goes away. Well, we need to do the same thing in our lower eyelid. We need to make sure there's enough extra skin there. In other words, when we look up and open our mouths, we want to make sure that the lower eyelid doesn't get pulled down. So we're always conservative with the amount of skin that we excise when we perform that. So let's say surgery isn't your thing, or let's say we're not recommending it because these days we do far fewer lower eyelid surgeries than we used to years ago. What we do is we manage the skin by helping to tighten it with what we're doing here today with Karen, with this laser that we're going to do in a moment. And so you can see, we just did this for Liz a minute ago, you can see the little pattern on here. So we're going to zip under her eyelid area. You're going to actually see the skin begin to contract when we treat, which is kind of neat. As I said a few moments ago, we're injuring the epidermis, the upper part of the skin, and the upper part of the dermis. And what will happen then is she'll have healthier, brighter appearing skin. We'll get rid of fine lines. We'll tighten the skin, and it also reduces the risk for the need for lower blepharoplasty. So dot laser is what you're going to see in a moment. With or without dot laser, Karen still may come back later, and in the tear trough area, in that valley, in that sunken in area, it's very likely that filler still could be used if she desires to rejuvenate the lower eyelids even more. So there are three things. We have surgery, we have laser resurfacing or many other modalities, and we have fillers. Today we're going to go ahead and use the laser. So I just wanted to give you an idea of what we're doing and how we're continuing from last month's theme for upper eyelid rejuvenation into lower eyelid rejuvenation without surgery. All right, so we're going to put some goggles on Karen here, and I'm going to put my mask on like I'm supposed to. And we're going to turn our laser on, and you're going to hear a loud noise. Leslie is here assisting, and you're going to hear just a smoke evacuation. Sometimes the smell of this isn't great, to be honest with you. So, all right, so we'll come over here. So what we're going to do is retract with this a little bit, and on the count of three, you ready? 1, 2, 3. You okay, Karen? Did it scare you? 1, 2, 3. 1, 2, 3. 1, 2, 3. And again. Good. And by your nose. Great. And now we're going to come back a little bit here. Karen, you good? Are you feeling anything? You are? Okay. 1, 2, 3. This is a great thing to do before Easter, you know. 1, 2, 3. 1, 2, 3. 1, 2, 3. We're in one more row here. 1, 2, 3. All right. You okay? Okay. All right. So that's one area here, and you'll see over the subsequent days here, she will have some swelling. Tonight she might see, you know, it's bloodless, it's not surgery, but she might see a little bit of what we call petechiae, or little blood droplets on her skin, and this will heal up over the next 6 days maybe.
Great.
She told me she wanted me to treat her light so she could make it to Easter, but we're making our adjustments here. Do you want to just do one side today?
No, we're good.
All right, you ready? 1, 2, 3. Okay? Great. 1, 2, 3. Then back towards the outside portion. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay? There's the central part. 1, 2, 3, and then the middle. Great. 1, 2, 3. 1, 2, 3. All right. I'm going to come back out here, and here we go. 1, 2, 3. 3. 2, 3. I think you did volunteer for this, didn't you?
No.
I think we have it on tape. 2, 3. By your nose, might feel a couple of these, maybe. Nope. Let's come out a little bit on this side, a little bit further. 1, 2, 3. 2, Looking good. A little mascara there. So, okay, so that basically is dot laser resurfacing. You wouldn't normally see her mascara here, but she's violated some rules, some makeup rules today. But what we'll do, and you'll see this, maybe we'll just stay live for a few minutes. We're going to go ahead and ice. Yep, that's fine. So we're going to go ahead and apply some ice probably for about 15 minutes and let her hang out. And then she will be ready to, if you were patient, you'd be ready to go home. We'll try to follow her progress, maybe with a few photos or a few videos along the way.
Absolutely.
Like I say, this is her mascara. It's, I'm going to clean that up. Let me just do this. Anyway, so you felt a little bit of that?
A little bit on this side, but nothing on that
Okay,
side.
okay. But
It didn't hurt. I just felt it.
well, thank you for being our model, and I hope you have a great Easter.
Yeah, thank you so much.
And all the other social
And
events you
all the
have
other
coming
things
up.
I have going
Right.
on. Got it.
So I think we're good. Well, Tommy, we could go ahead and hang out for 1 sec for the ice, and we'll go from there. Thanks, Karen.
Thank you.
Always a pleasure.